hopefully Fiona's with us as well.
Kia ora, I am.
Yeah. Thank you for
Sorry
joining
about
us.
that, guys. Sorry.
We'll hand over straight away and give you your 10 minutes. Please take your submission.
Tēnā koutou katoa. Good afternoon, everyone, and thank you for inviting Hauora Taiwhenua, the Rural Health Network, to make a full presentation on our submission to the principle of the Treaty of Waitangi Bill. I am Fiona Bolden, Chair of Hauora Taiwhenua, and I'm accompanied by Tanya Chamberlain, who is a representative of our Te Tiriti partner, Tupuarahi. I have worked as a rural for 25 years, and Tanya is the Chief Operating Manager of a rural-based iwi provider in the Hawke's Bay. Hauora Taiwhenua is a membership organisation for rural health providers, students and communities. We were compelled to make a submission on this bill because of the consequences this will have for rural health as a whole, and in particular for rural Māori. Hauora Taiwhenua, along with Otago University, compiled the available research on the current state of health outcomes for the 19% of New Zealanders who live rurally. Overall, rural health outcomes are worse than for those who live in urban areas, but this is almost entirely due to the huge discrepancies in health outcomes for those 22% of Māori who live rurally. This is most shocking for those Māori under 30 who are twice as likely to die from disease than their urban counterparts, and this is from preventable causes. For me personally, I've seen with my own eyes the consequences of inequity under the health system in Māori. I came to Kapia from the UK, where the rate of end-stage kidney disease requiring dialysis is 1,300 per million. In Kapia, I had 3 young people within the population of 300 under my care on home dialysis, a rate which equates to 10,000 people per million in the population. This is an example where an equity-based approach to healthcare is essential. The health system is not working for rural, and specifically not for rural Māori. They have not been given tino rangatira over their health, as per the 2nd article of the Te Tiriti. Giving Māori the opportunity to use their own perspectives and frameworks to address their health needs makes a real difference. Tanya will give her local knowledge on how this happens from a Hauora Māori perspective.
Tēnā koutou katoa. He uri tēnei no te waka tapu o Takitimu. No kahinunu, no nai tahu ko Tanya Chamberlain ahau. I speak with Hauora Taiwhenua, the Rural Health Network, and as Te Kahu Hautu for an iwi provider in a rural setting, Ngā Te Kahu Nunu ki Tamaki Nui Aroa, both who work relentlessly to address the inequities faced by our rural Māori whānau. I speak also as a Māori wahine and a nan, with over 3 decades experience working in various health settings, who has witnessed countless times how the system has failed us. Māori face the worst health statistics in Aotearoa. We are overrepresented in poor health outcomes, life expectancy gaps and preventable mortality. We are in a relentless fight for equity that leaves us navigating systems that were never designed with us in mind. We are making some progress to improving the health of our whānau, but this bill threatens to undo our efforts and undermines the gains we've made. The realities of distance and isolation amplify health inequities for whānau who live hours away from health services and simply cannot afford either the time or the cost to seek the care they need. They experience a health system that as a collective fails to respect the impact and past experiences of colonisation, discrimination and cultural disconnect. At an individual level, it often falls short of understanding the values and cultural needs of whānau, which often results in them feeling whakamā and often prevents them from following up on treatment seeking help in the future. Services like ours help whānau, many of whom haven't seen a GP for years, not because they didn't need the help, but because they didn't trust the system. By offering culturally safe whānau-centred care, we help them re-engage and achieve better outcomes. This is how Māori-led services make a difference to the lives and health of Māori. During COVID-19, Māori-led services mobilised quickly to protect our whānau and entire communities. We provided testing, vaccination and food supplies, stepping in where mainstream systems were slow to act. We took vaccination rates from the low 20s to up around 60%. Likewise, during recent cyclones, Māori were at the forefront of delivering emergency support to all of those affected, regardless of ethnicity. One of the biggest differences Māori-led services can make is through our focus on the prevention of health issues, working with whānau to identify issues before they arise, and supporting the entire whānau to make the changes they need to prevent things getting worse. Māori-led services empower whānau, allowing them to have mana motuhake over their own well-being. Our approach places the power to make decisions about well-being back into the hands of whānau in a way that is culturally relevant and deeply rooted in our values. When whānau are supported to lead their own care, the results are transformative, improving health outcomes and well-being in ways that the mainstream system has failed to achieve. This positively impacts the wider community and the wider health system. The Treaty Principles Bill poses a real threat to rural Māori-led Hauora services. If this bill proceeds, the equality prevails over equity. Targeted resources that enable Māori-led services like ours will come under threat. It will undermine our ability to provide culturally safe whānau-centred care and leave our rural whānau Māori and non-Māori in rural areas with no choice but to rely on a system that has historically failed them. Without the trust, the relationships that our services can form with whānau Māori, many will revert to not engaging with health services at all. The bill's Crown-centric approach threatens the autonomy of Māori providers, and it will strip us of the ability to develop our own solution. Rural Māori will be left more vulnerable than ever.
So we believe that diminishing the articles of the treaty to a set of principles defined by the government alone will undermine the gains and health outcomes that can be made by giving Māori tino rangatiratanga over the taonga, which is their health. Rural Māori lie at the intersection of rurality, poverty and ethnicity, where the poorest health outcomes in this entire country sit. Cultural anchoring is an essential component of designing and providing health services for our people, and this can never be done if we accept this bill. As an organisation, we unequivocally oppose this bill, as we believe it will lead to further health inequity and consequently more suffering and death for rural Māori. Thank you for listening and thank you for your time, and we welcome your questions.
Thank you, Fiona and Tanya. I'll hand over to the committee for questions. Any questions for Rural Health Network? Paul.
Kia ora kōrua. The minister in charge of this bill this morning talked a lot about how race shouldn't be, well, he kind of talked about how race is used in categories across our society. And I wondered whether you might want to offer an alternative perspective about why knowing that information and applying it to your health services is actually useful.
That's because we've got really good evidence from Professor Sue Kringle's work around what I was talking about the intersection of rurality, poverty and ethnicity, that people who are Māori and poor and rural do worse than people who are just poor and rural. And we've got good evidence around that. And that's why we need that information that we can then apply that to how we design health services to change those outcomes.
Thank you, Fiona. Thank you, folks. If there's no further questions, well, thank you both for joining us and for spending the time with us this afternoon and making.
I really appreciated hearing from the British nurse, Fiona. She actually reminds me of my local British nurse. But yes, she's absolutely right. And I'm so glad that she has identified, like my local British nurse has, that expanding services to Māori, who are often a hard to reach group of people in rural communities, benefits everyone. It actually benefits everyone, widening those services. And for Māori, who lost the means of economic production by losing their land, so they were unable to generate wealth, has put them in a position of severe inequities. And of course, a lot of their marae are out in rural areas. Okay, so when you expand those services for Māori, you're actually helping out Pākehā farmers too. Okay, it makes sense to have tailored programs that reach hard to access groups, because you got Māori that work in forestry, you got Māori that work on the farms. If you can reach those people, you also reach the people that run the farms and run the forestry sites. So it's like, hey, I know it's Māori, but do you need healthcare? It's like, you're Pākehā, do you also need healthcare? Here you go. Here's a service for you too. It's still healthcare.
No, you're right. I mean, I haven't ever heard of a by Māori for Māori service, like for example in the healthcare space, that's ever turned away a Pākehā whānau member or a member of the community who happens to be Pākehā from coming into service. So you're right. When you deliver service into the community, everyone benefits. But I found that presentation incredibly powerful and very, very challenging to this kind of growing narrative that we're seeing coming from ACT at the moment, that we really need to strip back this cultural lens and focus just on need, which is very deceptive, because it kind of makes you think that cultural elements don't fit into need, because I mean we had a very clear statement there from I think it might have been that same nurse actually, where she said that we have rural elements, we have poverty, and we have Māori all intersecting in there, and we have evidence to prove it. You can't walk away from that when you've got evidence to show that all of those three factors are intersecting in a exponentially higher need for services. So I mean, I found that really, really challenging one to watch when I watched it through the first time, because it just challenges our understandings around what need is and where it is and how we need to deliver to it. And it's certainly not this kind of elite concept around need. It's really just around we need to back our communities to deliver in a culturally safe way. Because I mean, I'm still hearing stories this weekend around how our health services are not delivering in a culturally safe and appropriate way, particularly for Māori and Pacific families. I mean, this is kind of an overhang from when we got rid of Te Aka Whai order, which was really hoping to set up an infrastructure to deliver health in a culturally safe and appropriate way. And we started to make some progress in that space. But we've been going downhill since then, and this is now just an accelerating of going downhill even further and faster. But yeah, I really took a lot away from that one. Very, very good. I
mean, take my situation. I mean, I'm part Māori. I live in a rural community. Now, Ika Tahuna, where I live, we have a community-owned healthcare centre that provides healthcare to everyone. It's Māori people work there, Pākehā people that work there. The nurse practitioner is Pākehā. She's British, right? She's very open-minded and accepting of all people. That's what you want in a healthcare system. She'll come out to you. She'll come visit you in your time of need. She doesn't care what ethnicity you are. She will adapt her ability to care for you if you're scared, right? Or if you're skeptical, and many Māori people are scared and skeptical, especially those of the older generation, of the government and of, you know, modern medical science and whatnot, right? It is the role of the healthcare provider to to ensure the comfort of the patient that they are treating. And sometimes that involves taking a Māori perspective, right? Making sure that you're coming down to their level. Same with disabled people. You have to tailor yourself so you can provide care for them. This is not a race-based thing. It's a needs-based thing. That's why I don't understand why he's like going, well, you know, we shouldn't be dividing healthcare by race. I'm like, sometimes you have to have a different cultural approach so you can provide the healthcare that the patient needs. That's just a fact of reality. Sometimes you have to say kia ora instead of saying, oh, hello there. And you know, well, hello there. You know, so yeah, sometimes you have to tailor your approach so you can provide the healthcare. My dad knows this from experience. He was an optometrist. He worked with everyone, different cultural backgrounds. He had people come in from Africa who thought optometry was witchcraft. You know, my dad, being an Englishman, had to reapproach the way how he provided care so they could receive the care they needed.
That is absolutely right. Yeah.
Thanks for watching. Make sure you're subscribed to our Facebook, YouTube, Twitch, Instagram, TikTok, News Guide, the Order Paper Podcast. YouTube, Twitch, Instagram.